There we go. Okay, so Emily, you should be, okay, you are a co-host. There's Kaylin, co-host. Gonna have a lot of co-hosts.
Did we agree on who was staying out here?
It's gonna be me.
It's gonna be you. Okay.
I just didn't want to break anything, and I figured I would have the easiest time knowing all the settings and everything. So.
Hello.
Hey, Janine.
So Chris, are we gonna need to have the PowerPoint up on our own personal laptops? Probably.
Yes, when you go into the breakout room, you'll need the individual presentation, because you'll have to share your screen.
Yes, already. Get those pulled up.
Starting to see lots of folks start to join. We're going to give people a few more minutes just in case they're coming back from lunch, and have a few more people to make co-host as well. So I anticipate we'll probably start around 1:05. So just hang with us until then. Thanks.
We really should have made like a nice like lake sound soundtrack to go along with this picture. So everyone's just gonna have to do some visualization. Pretend you're at the beach.
Should have just tried to go to the beach, probably.
Yeah, except I don't get really good cell phone reception on the shore.
That is true.
At least I didn't in South Haven. I don't know. I think that would be nature telling me to get off my phone.
It's frustrating though when you try to find somebody and your cell phone doesn't work if you're meeting somebody there. Definitely had that happen.
If you're just joining, we're going to be waiting a couple of minutes for folks to make it through the Zoom intro and join us.
All right, so it's 1:03. We'll give it another 2 more minutes for the rest of the folks to join us, and then I'll get started. And whoever joins from there can join us then.
While we're waiting, I'm just curious if this is your first ever Healthy Capital Counties meeting, if you would love to, I would appreciate it if you could introduce yourself in the chat. Just go ahead and write in the chat who you are and why you're here. And we'd be really interested to meet you. Thanks.
Okay, it is 1:05, so I will go ahead and get us started. Welcome everybody to our data party. So some folks are joining us for the first time. Some folks are hopefully have experienced the data party in its in-person form. And for those of you who have, we're going to try to do this virtually. So hopefully we can live up to that experience of the first time. And then hopefully next time we do this, we'll be able to do it in person again. Fingers crossed for that. First thing we're going to go through just kind of what we're going to be doing today. So I will just kind of update everybody on where we are and what we're doing with the project for Healthy Capital Counties. I'll introduce us to the data party tour. Then after that, we'll break out into our sessions. So for those who joined us the previous time, these would be like the stations we went through, except we're doing them for breakout rooms through Zoom since we can't meet in person for obvious reasons. We'll have a little bit of a break and a discussion after that. We'll come back for a few more stations and discussion of that data. We'll have another group discussion and then just sort of highlight our next steps going forward in the process. And for those of you who are new to the process, I'm going to go over just a little bit about what the Healthy Capital County is and what the community health needs assessment is in general. This movement largely started around 2010 with the passage of the Affordable Care Act. There were some requirements set forth by the IRS for hospitals to maintain their nonprofit status. And those have largely to do with like monitoring community health and chronic disease and those sorts of things. While at the same time, we in the public health world have an accreditation body called FAB, the Public Health Accreditation Bureau, who have similar requirements for us to have a national level recognition. So that's outside of like our state level accreditation process. It's supposed to be that higher level of accreditation. And then the basic definition of this process is that a community health needs assessment and improvement plan is a systematic process involving the community members to identify and analyze the needs of that community through whether that's needs or assets, to prioritize them, and then to come up with an improvement plan that addresses those unmet needs that we have found. This is a little bit of a graph that shows us what that cycle looks like visually. So we are right now at the top. We are at the community health needs assessment part. And it's just generally asking the question, how are we doing? And we find that out by collecting various data sources. So we have our own primary data sources. That's stuff like our behavioral risk factor survey. That is out in the field right now. It last updated 2019, so that is the data that we will have, 27 to 2019, it's 3 years of aggregated data. And that is part of our assessment this time, and then we'll have another one going forward into the next one. From all the data we collect, and then there's secondary resources and sources such as state data, CDC, federal sources, those sorts of things, community surveys, and all that. From all that data, we present it to the community, and then we also, in the end, we will have the community help us prioritize what we want to focus on. And that is what leads into the community health improvement plan. So that, like I just said, is asking the question, what are we going to improve? And then from there, we come up with the actions that we want to do. We want to monitor those. We pick the ways we want to monitor and evaluate to see how we did and if it worked. And then we repeat the cycle again when we update our data. This is sort of the model that we have used for this. It's kind of the base model. We've made some changes along the way. So the base model is from the Association for Community Health Improvement. And it's their community health assessment and improvement planning project. This was made by folks who work on both the hospital side and the public health side, so that it can fit those dual roles, like I had mentioned earlier. We did modify some of these steps just so that we can meet those FAB accreditation requirements. It also includes along the way health equity principles. While we were framing the project, we wanted to allow for the inclusion of the social determinants of health. And those are defined as the physical, economic, and social environment in which people live, and the participation of the communities that are generally marginalized, and also actively engage the community for feedback, for a way to shape our process. These are just copies of what our previous publications looked like. So you can see we've been doing this for a while now. The first cycle had kicked off in 2010, and we anticipate publishing our next one in around mid-October of 2021. A little bit of a recap of where we are and what we've done so far for everybody who is seeing this for the first time. We have collected our quantitative data, so that's our numbers, those primary, secondary data sources that I mentioned earlier. We had previously selected our indicators, so that was our first kind of kickoff meeting with the community, where we selected roughly 35 indicators. And we had ones that we previously used. We swapped out some new ones all through that, so that we can have what matters to the community in there. So as it says there, the data collection and the analysis of that portion are finalized. So we have our graphs, our data that we're going to use to construct our narrative to be later published. We have also done significant work on our qualitative data. So our stories, our focus groups are finished, and we are analyzing them now. We've completed analysis on most of them. We still have one or two outstanding, but we do have some good feedback from those that we have done. Another portion that we have brought to the public beforehand was asset mapping. So those are the things that the community wanted to see included on a map. And for this cycle, there was interest around having interactive map. And in this case, we have populated our healthcare services and those that include mental health and recovery services on a Google map. So you can find that on our website at healthycapitalcounties.org. And it will also be included in various forms in our final publication. The other aspect that we'll include for asset maps will be static maps, so maps like you're used to seeing in our publications, and those will highlight our food systems and housing services. We continue to do outreach for this process, so I'm assuming most of you guys have received or been forwarded the emails through the Healthy Capital Counties listserv. We do Facebook posts to promote these events, to promote our focus groups. And we'll continue doing that, and we will certainly let the community know through those avenues when we have the publication ready and when we start sharing the data. The community input sessions, those kicked off in December 2020. So you can see the stakeholder meetings. The one was a kickoff in December. We had another in February, and then this one in August. We have finished our community survey. We had over 1,000 responses on that one, and we finished our healthcare provider survey, which I believe we significantly eclipsed our total from last time as well, which is always nice. We are targeting our publication of the document, or at least a temporary draft of it, for mid-October before we complete our prioritization. And then once we do complete prioritization in late October, as you see there, we will add that into our draft and our final document. So just to follow up for those who were at our previous events, that is largely focused on our asset mapping. So we have finished the healthcare services, including the mental, physical, and behavioral health services. That is on our interactive map on healthycapitalcounties.org. And we are working closely we're getting close to finishing our food systems and housing services one. And these maps were developed in partnership with the Tri-County Regional Planning Commission. So we thank them for all their help in that. It's been very, very helpful and productive to work with them. And now I will move on to kind of what we're doing here today, our data party. So what is a data party? So essentially, last cycle, there was identified a need to get data in front of the stakeholders prior to completing our prioritization. We wanted to give folks the opportunity to reflect, to comment on the data, to tell us if something didn't seem right, if something was interesting, to tell us, we don't think that works, those sorts of things, or if they'd like any last minute changes before we head into that prioritization part. So the data party is a tool. So we want to make it fun. We want it to be interactive. So when we do go into our breakout rooms, we want it to be a really productive discussion, a fun discussion. So if you feel anything during those times, please bring it up. We want to have a good back and forth there to get as much feedback from you guys as possible. The data party can also, discuss us can lead the way to discussing actions that will result from the data. So the things we can do, the things we may want to, the actions we want to take going forward based on those. And it will help us shape our final publication. Like if I said, if you tell us something that is missing or something that needs a little more context, so we can make sure we paint that complete picture when we do reach final publication. So this data party is envisioned as a data tour. So the concept of this is we're going to take a road trip around Michigan. We will have about 6 destinations. So our first breakout session is going to be destinations 1, 2, and 3. Then we'll do a little feedback form. So for those folks who had joined us in the previous cycle, we had little postcards or passports that we called them that were filled out at each station where you could give us feedback. We're trying to mirror that here, except through a Google form. So we'll have some dedicated time at the end of those sessions for everybody to fill it out and make sure we have all the feedback that you guys want to give us in addition to what we have recorded here. We'll take a little break after that, just so everybody can get fresh, and then we'll come back. We'll do a second breakout session for our second 3 locations. Again, there will be the Google form. I anticipate we'll spend roughly 20 minutes in each breakout session, maybe a little bit more on the second one as there's some more content there. And after we finish that one, we'll come back. We'll have a large group discussion just so make sure everybody's on the same page and we capture as much as possible. So some tips for about what we're going to do when we get to our destination. So your tour guide will go through all the different locations. There's the different indicators tied or indicator groupings tied to each one. So your tour guide will guide you through it. So they will ask you questions, they will prompt you. But if you feel like you have something to say, go ahead and say it and have that discussion whether or not the tour guide asks you a direct question. Again, feedback, that is the most valuable part of this. So please give us as much as you can. And then, like I said, we'll regroup after we fill out the form, and then we'll come back and we'll have a little bit of a large group discussion, and then we'll go from there. So a preview of our destinations, we're going to kick off in Detroit. We'll go to Ann Arbor, we'll go over to Holland, the Dunes, Traverse City, and Mackinac Island. And I know this will come up, so I'm going to answer it now. There is no rhyme or reason why any of these locations were chosen. There's no measures tied to anything in particular. We just wanted to reflect the idea of having a road trip that we could have an easy start destination and make like a little bit of a loop around the state. So just in case anybody was already thinking about it, I thought I'd jump ahead and get that out of the way.
It's really about where we wanted to go visit when we were making this presentation. So
yes, and that was certainly when COVID was less of a concern than it was. We were all ready to go on a big road trip. Maybe less so now, or maybe not. Who knows? But we'll have a nice virtual one today for sure. And now, what to expect kind of when we get into the room. So our next slide will pop up in just a minute. It'll be our first leg of destinations. That is when I will open our breakout rooms. You will be automatically moved into your room, so you won't have to click join. I will give roughly a 5-minute warning as to when I'm going to close the rooms. That's to give everybody time to get to the end and then fill that feedback form out if you haven't reached that point already. And then when I close the room, there will be a 1-minute period where you can click to rejoin, and if you don't, it will rejoin you back anyway. And with that, I am going to get our breakout rooms going. All right, let's see.
does anyone have any questions or concerns at this point? Okay.
All right, here we go. Let's hope this works, everyone. Enjoy your breakout room.
Hey, Chris,
Yes.
I didn't have the Google form link. Could you post that? So,
Yeah, when everybody comes
Oops.
back, I'll put it in the main chat.
okay, great.
Okay, I think everybody should be back with us now. I'm going to go ahead and put in the chat the link to the form just in case nobody had or anybody didn't have a chance to do it. A bit of note that I hope in the message you saw, the capital D does matter. If you use a lowercase d for data party, it will take you to something completely different. So just something to note while doing that. And all right, so with that, we'll move into our bigger group discussion. So if anybody would like to start with anything that they noticed that was interesting, confusing, anything of the sort. So now would be time for an open chat. So if anybody has anything to tell us.
I can answer Linda's question that she just asked in the chat. So
Okay.
Ionia County is not part of the Healthy Capital Counties project. It's just Ingham-Eaton and Clinton, but we are pulling the data, similar data sets in terms of quantitative data for Ionia County. So if you are interested in looking at that, let us know. Let Chris know. We can get that for you. So my question to the group is really, what stood out for you of the data that you saw that you found most surprising or important?
Hey, this is Tina Gross. I think that the housing and equity of the housing was pretty significant to me. And I just wonder if they use this, we know what we use it for in healthcare and such, but I wonder if they use this information to determine where they're gonna maybe focus on more affordable housing.
Yeah, there definitely were a lot of differences between the different groups for sure. So Chris, can you repost the link with www with it? Or whatever it is.
Yeah, I've had some, I will try it. I did have, the best way I had it was the way I posted it. We'll try this too.
Okay.
Okay, use Emily. Emily sent it out to everybody, so I would take her link because mine apparently didn't turn into a link. So let's use that one.
Other observations. I know in our group, we had some discussion about the educational categories where our group felt, some folks in our group felt that not including people who have a certificate or some type of technical training might be, might be, just a limitation of this data source.
Sure. I mean, is that something that folks would like to see going forward? Because we're always open to not maybe necessarily changing this time, but like to have an idea for going into next cycle. Do we think that would be a productive thing to have in there?
Yeah, I think it's worth exploring in the census to see what we can get.
Yeah, I was wondering if there was an actual indicator measurement for that. Like my son is like a journeyman, like concrete person. And so like it's the equivalent of a degree, but he wouldn't be counted in the data. And I don't know if there's a way, I don't know how you even collect those kinds of credentials.
I believe that our CAN councils do. MCAN probably has that data. Because I know that our college access network folks track that.
If they need to be licensed for anything, Lara would probably have it as well for for some other things like EMTs or things like that.
Thank you, everybody.
For the food desert category, what do we consider a grocery store?
That's a good question. The grocery store, I don't have the exact definition, but it's generally anything that you can buy produce and generally groceries at. So that would be pretty expansive, but it's not specifically like a Meijer or a Walmart. It does include smaller stores as well.
I was
Yeah, it's
surprised at
the
those numbers,
USDA definition.
but
Yes.
I realized with our group discussion, I realized that those numbers were really just for the low income families, not including anybody else in that.
Right.
Yeah, we're following the USDA's definition of food desert, which does have some limitations, especially because they assume that rural folks can drive like 10 miles to get groceries. And that isn't always the case.
Right, that's what we see. You know, it's that middle class that I see, you know, in our county struggling a lot with access to food, and transportation is typically the reason.
Having done this in other arenas, typically you look at a food desert for those that have limited transportation. How quickly can they access fresh fruits and vegetables from the stores around them? That's really what helps establish food deserts.
And Kate gave us a great suggestion in the chat. Thank you.
Did anybody find anything interesting? So one of the new measures we have this time is our social capital. So that's the one with adolescents who know adults in the neighborhood that they could, you know, have something important to talk to. Did anybody find anything interesting about that measure?
We talked about the wording of that question because it specifically asks if there's someone in your neighborhood, and someone may have someone they feel comfortable talking to, but we were talking a little bit about the way the question's worded might cause some people to say no, where they might actually have someone in their life that they feel comfortable talking with. They're just not in the neighborhood.
That's true, especially with like social media and messaging and apps and everything. It could certainly have an impact on that as well. Absolutely.
It made me realize that some of the work that we do in our county, we could be asking some of the questions that are similar, but not exactly, like things that we think get at a question in a different way, rather than only having that source of data. But there may be places and times where we can drill down and learn a little bit more about some of those.
And to answer, there's a question in the chat. So for housing data, was property tax taken into consideration, or is it only housing values? I am not sure off the top of my head. Let me find the slide really quick so I can look at it. I don't believe it probably had.
Is there anyone from Ingham that worked on the data poll that could answer that question? It might have been Jonas. So we'd have to get back to you on that.
It does say housing costs. So I would assume that would take some property tax into account, as it's not just housing value, it does say housing costs. So it's a little bit more broad of a category.
Yes, Jonas worked on this one. I worked on the MiFi data.
Thanks, Janine.
All right, so that was the last topic we had for that section. So does anybody have anything else they'd like to mention here before we head into our break?
I will just say, Chris, that I barely got through I mean, we spent most of the
That
time on
actually
the first couple of
gonna be my
slides,
question,
so
yeah.
I'm gonna need more time.
Okay, did everybody else feel that way as well? I certainly, we were trying to take a guess at how long it would be. But I know there's more in the second half, so I can certainly prepare for a little bit longer of a session there.
Yeah, we didn't get to the last couple slides in our group either.
Okay, so I will definitely add another about, let's say 5 minutes. So I was planning 25 because there's more, so maybe more like 30. Does that sound about right, Anne?
Yeah, more time is always good when I'm talking about data.
That's fair. Okay, with that,
But I'm sure my group would rather we wrap it up.
we will take a break right now. So we'll have about 10 minutes just for guys to get a drink, stretch your legs, anything else you need to do. And we'll be back here. Right now it is 1:52. So at 2:02, we will get started with our second breakout session. So I'll see everybody in a minute. All right, everybody, we have about 2 minutes left, and then I will put out a little poll to make sure everybody's around, and then we'll get started with our second session.
Okay, it's 2 o'clock on my watch. Chris.
Okay, so I tried to get into a poll and it ended up almost kicking me out of Zoom. So instead, if anybody wants to just give me something in the chat or say something to see how many people are around before we break everybody into rooms again to get a sense of who's here.
I only see a couple abandoned desks.
Well, that's good. So then we'll just go ahead and do it and see what happens. All right, here we go for round 2, everybody. I'm going to open them up right now. All right, looks like we have most people coming back, so we'll give the last folks just a couple more seconds to come on out, and then we'll finish up.
Uh-oh.
All right, everybody should be back with us now. So Kaylin, could you go ahead and drop the link in here now? I did have Kaylin go through every room and give you guys the link directly, so hopefully that worked a little bit better. She also just put it in the general chat. So hopefully that was a little bit better this time. So now we're back together. We'll have a little bit of a group chat here. So for the second session, so these are the questions we're looking for. So what were people, interested by or surprised by? Was there anything that stood out offhand?
We spent a lot of time talking about the obesity slide because 10 years ago, our 3 counties were significantly lower than the state in terms of rates of obesity. And we've exponentially increased, whereas the state has done more of a steady increase. And we were just spent a lot of time on what the cause of that might be. That 10 years ago, we were almost half of what the state of Michigan's rate of obesity was. And now we've caught up in 10 years time. So that was something surprising.
Yeah, it's always surprising to me to see the rate at which that does happen. Certainly, you hear about it all the time, so you expect maybe it would be a little bit less of an increase, but it does kind of surprise us. Anything else that stood out for everybody?
I just noted that, the infant mortality slide, there are people looking at, when we looked at that, we were talking about that, and it'll be important that we include disparities by race and ethnicity in the final publication.
Absolutely.
So that wasn't one of the slides that we shared, but we need to make sure I'm sure that data will be in there. But that it definitely felt like it was missing from this discussion.
Okay. So a couple questions were sent to me in chat. The smoking data, yes, that is just cigarettes. That does not reflect vaping. So that is certainly something that could be a little confounding there with seeing things going down. But vaping data is still pretty not robust at this point. It's still kind of getting to the point where we can measure it well. But that does just reflect tobacco smoking cigarettes. And another question about poor mental health. That was measured through our BRFS, which is our survey that goes over 3 years. So that is part of the question set for that. And it asked the number of days in the past month that you've had poor mental health or thought you were experiencing poor mental health. So did anybody notice any other trends or disparities that stuck out?
Our group was curious to know if watching the medical waiver for immunizations go down across all 3 counties for 2019, is there a way to see if vaccines went up or if it was just that loophole or, that the steps got harder to get the waiver? We were just kind of curious about whether the immunizations went up with that.
So that would be a separate data pull from MICR, which is our data source for that. So I can't say offhand. That would be something that we would have to look into separately. But if the loophole goes down and there's no documentation, then in theory the immunizations would go up. But it would certainly, I would agree, it would be nice to see kind of that side by side.
Great question. Thank you.
There are 2 things in our group. We saw that the Hispanics are much better at eating fruits and vegetables and consuming fruits and vegetables daily than other racial groups across the board in the 3 counties. And the other thing is that we saw that the number of people with no primary healthcare doctors is kind of increased in the past few years rather than decreased.
Yeah, that surprised me as well, because you see the kind of initial decrease when we started this process around the Affordable Care Act. So you see kind of the effect that it had immediately. And then you see some of that starting to slip back from people who don't have a primary care physician. That could be.
And some folks in our group discussed that, you know, what they were seeing in the community was that there was a lack of availability. So like there wasn't provider capacity available for the people that are interested in getting a primary care doctor, or at least ones that don't accept their insurance.
Absolutely.
One of the things I thought of when we were talking about that, and just dawned on me, is that I think there are other areas in the state that are much better about using nurse practitioners than we are in the Tri-County area for primary care. And maybe that might be some of the disparity that we had here with the state. I don't know. What do you think?
Could be.
I haven't looked into that. Anyone else know?
Not offhand, no. That would be interesting to dig into. I'm not sure of the wording of the question offhand, so I'm not sure if they're asking specifically if it's an MD or if we could expand language to include advanced practitioners as well.
It is worded, if it's a BRFS question I'm thinking of, it's the way it's worded is, do you have someone that you think of as your you know, personal healthcare provider? So they don't say doctor.
Okay. So then that would, okay. Okay, does anybody, so we are getting close to time here, so I want some free time for discussion afterwards. So does anybody feel like anything was particularly missing or needed more context or more information?
I will say, Lori came up with some great ideas for some crosstabs in the MiFi data. So I think that, you know, as we move along, you know, we'll have to be thinking about, is there a way that we can do some of those more complex analyses as opposed to just reporting the frequencies that we have, because that's really what this is, right? We just like, here it is, here's what they said about this one question. And there seemed to be a lot of interest in the relationships between some of these things that we were seeing. And so sometimes we can't do that because they're coming from completely different data sources, but if they're coming from the same data sources, we might be able to take a look at that. So I don't know that we'll be able to do it for this report because COVID, but I do think that that's, you know, I really appreciate that feedback, and that's something that we can keep in mind for data updates for sure.
And I had a question for you. And I think my head's a little clunky and I don't remember exactly what the end of this road is, but are there strategy recommendations that come in your report from this work, or is it more of just a general state of the county or state of the region on healthcare?
So we will have our prioritization session in October where we will select like, okay, here's the priorities for the capital region on, you know, health. And then we will go into and we'll have a final report with the data in it, but then we will go into our community health improvement planning process. And so that is really where we're looking at, okay, if we're going to do something about immunization waivers and immunization coverage, what are we going to, if we picked that as a priority, what are we going to do about that? And so I think that is absolutely part of the process. And ideally, what we would like to see at the very end is that we are planning together. So not necessarily planning as healthy capital counties, but within each of our different, you know, groups and coalitions. And, you know, so for example, the substance use prevention coalitions have been doing much more comprehensive data analyses and plans for years. And so this is intended to kind of bring additional attention and support if that indeed is one of the priorities that we pick.
Great, thank you.
Okay, we have about 10 minutes left, so does anybody have anything important they'd like to mention? Otherwise, I will move on to our kind of next steps, which Anne already mentioned, but we'll go over them anyway. So last chance, anybody got anything before we move on? Okay, I'll move on to our next steps. So the things we discussed here today and the things you discussed and were recorded in your sessions and we talked about here, those noteworthy themes, findings, suggestions, we do plan on incorporating them how we can into this cycle, and then if we need to, the next cycle as well. So the things that we have upcoming, so incorporating today's feedback, like I mentioned, we'll finalize our asset mapping. We'll start releasing bits of our data. And then sometime around mid-October, we will have a draft of our publication that we will have ahead of our prioritization meeting, which brings us to our last stakeholder meeting, which is prioritization. And that will be in October, where you will see that summary of the complete assessment. We'll prioritize, and then that prioritization section will be added to the final document.
And
go ahead,
if you, sorry, I was just going to add, if you haven't, I will add anyone who registered to this meeting. I think we have their email address, right, Chris?
Yes, we should.
If you aren't already on our email list, we will add you. And then for those that message me, I will also add you. And then the folks that 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 would want to be interested or a part of this, you have to just go to our website, healthycapitalcounties.org, and there is a form in there to fill out and become to get on our listserv, so our mailing list. So that's available anytime. For any community member is welcome to sign up for email announcements of the next meeting. And then I did want to reassure people that we will be sending out a copy of the report ahead of that meeting, and so be on the lookout for that. And then we will also be sending out registration information for that meeting as well.
Yes, thank you, Anne. So that is all we have for you guys today. If anybody wants to stick around and ask questions, we'll be available for the next 10 minutes. And if not, well, thank you for joining us.